Hello, boys. How are you? Well, I didn't see you for a long time. How are you? What about this quarantine? Okay, I have some questions first before we start. Can you find the homework in our website? I asked the other day for your emails, or your mom's emails. Well, could you do it? Well, then tell me. But today we are going to start with the lesson. But remember, before we start, to write, yes, the day. Today is 25th of March 2020. And our class is going to start, of course, with this new and main topics that is coronavirus. So we are going to start analyzing certain vocabulary in relation with coronavirus. A large prevention campaign around the world for coronavirus. Okay, so here, as you can see, we are going to see the transmission, yes, and also the symptoms that a person can show when have this disease. We're going to start with transmission. We have different ways to obtain this virus. For example, from the air, that is why we are going to use mask in our mouth and nose. Also, when we touch contaminated object. For example, imagine that you are in the train, yes, and you touch a lot of things, and before you, a person also touches that and have the virus. Well, if you don't pay attention and you don't take care of yourself, you can touch a contaminated object and now you have the disease. Well, in fact, this disease, according to some experts, started because the Chinese eat um, different wild animals, like, for example, bats. The human contact. That is why we can't hug or kiss each other, or also shaking hands. It's very, very important to have social distance for other people. Okay, well, now what are the symptoms? Well, as you can see in the picture, in the image, we have symptoms as a flu, for example, higher fever or temperature or cough, yes? But then we have another kind of symptoms, for example, diarrhea and vomiting, yes? In fact, we now know, because we can see every day in the news, that the patients that have this disease say that they suffer very, very, very bad this disease, because they can breathe, they feel very, very bad. That is why we have a hashtag around the world called Stay at Home. In Spanish, me quedo en casa o quédate en casa. Why? Well, because different governments around the world, diferentes gobiernos, tried to remind the population about stay at home. Yes? Because they believe that it's a national effort, because to slow the spread of the disease, we have to stay at home, yes, and save more life. Of course, imagine that you feel unwell and you want to go to the doctor, and there you find a lot of people, yes, so it's very important to stay at home. Now we are going to see a video, yes, and we are going to listen more than anything to the Prime Minister of England. Yes, listen carefully about what he say about this hashtag, stay at home.
Good evening. The coronavirus is the biggest threat this country has faced for decades, and this country is not alone. All over the world, we're seeing the devastating impact of this invisible killer. And so tonight, I want to update you on the latest steps we're taking to fight the disease and what you can do to help. And I want to begin by reminding you why the UK has been taking the approach that we have. Without a huge national effort to halt the growth of this virus, there will come a moment when no health service in the world could possibly cope, because there won't be enough ventilators, enough intensive care beds, enough doctors and nurses. And as we've seen elsewhere in other countries that also have fantastic healthcare systems, that is the moment of real danger. To put it simply, if too many people become seriously unwell at one time, the NHS will be unable to handle it, meaning more people are likely to die, not just from coronavirus, but from other illnesses as well. So it's vital to slow the spread of the disease, because that is the way we reduce the number of people needing hospital treatment at any one time, so we can protect the NHS's ability to cope and save more lives. And that's why we've been asking people to stay at home during this pandemic. And though huge numbers are complying, and I thank you all, the time has now come for us all to do more. From this evening, I must give the British people a very simple instruction. You must stay at home, because the critical thing we must do to stop the disease spreading between households. That is why people will only be allowed to leave their home for the following very limited purposes. Shopping for basic necessities as infrequently as possible. One form of exercise a day, for example, a run, walk or cycle, alone or with members of your household. Any medical need to provide care or to help a vulnerable person, and travelling to and from work, but only where this is absolutely necessary and cannot be done from home. That's all. These are the only reasons you should leave your home. You should not be meeting friends. If your friends ask you to meet, you should say no. You should not be meeting family members who do not live in your home. You should not be going shopping except for essentials like food and medicine. And you should do this as little as you can. And use food delivery services where you can. If you don't follow the rules, the police will have the powers to enforce them, including through fines and dispersing gatherings. We will beat the coronavirus, and we will beat it together. And therefore, I urge you, at this moment of national emergency, to stay at home, protect our NHS, and save lives. Thank you.